Hey everyone, so first of all, I'm so sorry if you can listen to the TV, but Yeti is sleeping, so she usually if everything's quiet, she'll wake up. So I don't want to you know, wow. I don't want to turn it off because she's gonna end up sleeping, and right now it's nighttime and I'm gonna use it to clean up the house after dinner. So I didn't give an update about how my orientation, like floor orientation, went. So that's what I'm doing right now. I love it. It is more than what I expected, and oh my, am I learning so many things. It's not just like documentation and stuff like that. Like, I am sincerely learning so many things. It's really, really awesome. So I'm a postpartum nurse and I work in a hospital here in Texas, and it's amazing. Like, you learn so many things. I love taking care of those new moms that are so fragile but yet so strong because they just had a baby, but they're so confused because some of them are new moms, so they don't know what to expect or what to do. They have so many questions, they're in pain. So I like to be that person that's gonna comfort them, that's gonna help them, that's gonna, let them know it's gonna be fine, and soon enough you're gonna be home with a newborn and you will be capable of taking care of that sweet baby. My hospital right now, we're just doing like postpartum. We don't do the mother and baby, but it is looking to do the transition, which it's a little scary, but I feel like it's gonna be fine. There's another lady like that I mentioned her. I mentioned her on my video for the Car Chronicles. If you haven't seen it, please go watch it. And she is a postpartum nurse like for the longest, and she used to work at a like really big hospital in California. So she says they over there they do mother and baby, and she says it's better. She really likes it, and she's able to take care of both of them at the same time. I just have to learn, like kind of the nursery part of it. It's not just the adult mommy part. Is you have to take care of a baby. You have to learn how to do their assessments and everything, because one thing is learning how to do it at school and filling out papers, and then it's like, what is my hospital expecting from me, and filling out the papers my hospital is expecting. So yeah, you have to like figure out what does my hospital want from me. My preceptor, um, I'm just gonna say I'm glad I'm not a new nurse. She's good. She's a very knowledgeable person. She knows a lot. My only downside of it is that at the same time she was precepting me, she was charging. And I'm not going to be taking the duty of being charge nurse. So it kind of threw me off because she was taking care of some duties that she had to do, but then they didn't pertain to me. So I was just there. Everybody does things differently, so I know I'm not gonna get the mannequin that's gonna do everything perfect. But being a preceptor, that's what you kind of expect, because you expect the right way, all the way, every day. And I kind of didn't got that. So and sometimes she forgot I was there, so she will go like fast. But I always ask questions, I always took notes, I try my best to just follow her, make her feel comfortable with me too, kind of let her know I am following you, but I will like definitely respect your space, but I need to learn. So I'm gonna ask questions and I'm gonna be very proactive. So I feel I was very proactive. I learned so much. Like, I was on my second day, I took a patient and she was like, yeah, good job, you're doing all the documentation how it is. I didn't do a few little things there and there, but she was like, well, you're learning, so just keep going. My third day, it's going to be Saturday, and I take one patient again, and then next week I work Thanksgiving Day, but I guess, and then that week I'm taking two patients, and then I'll be transitioning tonight. So I will let you know at the end of my day shift orientations, how is it going, and then I will do a how my night shift orientations are going, which I'll be working night shifts mostly. I can say it's, if people think, oh, postpartum is just like, no, there's a lot of mamas having babies. This girl had 4 discharges and 3 admissions in one day, and I was just like, Lord Jesus. So yeah, overall, it's really nice. I really like it, and I feel like I'm gonna do a good job. You know, I'm very positive, and if there's any postpartum nurses out there that watch this video, or anybody that wants to go to postpartum and you have a question, if you have a question, put it down there. I'll try my best to answer it. But if you're a postpartum nurse and you have advice for me, please just throw it out there, because I'm all about learning. I love to learn, and I am not ashamed of asking questions. So that's, I think, if you're a nursing student, if you're a new nurse, if you're just a nurse and you don't know something, ask. Okay, that's gonna get you a long way. So, and don't feel discouraged just because of the type of preceptor you have. You know, like, I try to keep telling myself, you're gonna be fine, you're gonna be fine. And you know, she's human too. She can't be perfect. But overall, I have learned a lot, and I just want to thank you everyone for taking the time to watch this video. I do not look my best because it's about 11 p.m. and I'm trying to figure out what I'm gonna do, because I'll probably be cleaning and tidying up the house. But anyways, thank you so much for watching. I will definitely keep y'all updated, and I'm very excited. It's fun. Nursing is fun. Bye.